Before we continue our scheduled agenda, I want to invite our president, Dr. Harmon, to the podium for a very special address to this House.
Good evening, and thank you. Gun violence is a plague on our nation. It's a public health crisis, and much of it is preventable. As we start this meeting, we're going to have a moment of silence for the victims of gun violence, including physicians and other healthcare workers who have been harmed. First, it's important for me as your AMA president to speak on this important topic. Almost every day in this country, we bear witness to the shocking brutality of weapons of war being unleashed on society, on elementary school students, on movie theater goers, on grocery store shoppers and people in houses of worship, on physicians and healthcare workers, and hospitals and clinics. This cannot be our new normal. Gun violence is out of control. Enough is enough. Doctors witness this trauma firsthand. We see it in our emergency rooms. We see it close up in our emergency departments, our trauma centers, our morgues. The House of Delegates first declared gun violence a public health emergency in 2016. And decades prior to that, the AMA was pushing Congress to pass common sense reforms to help keep guns from the hands of people seeking to inflict pain on others. AMA's policies call for banning military-style assault weapons and high-capacity magazines, for expanding background checks and waiting periods on firearm sales. It calls for eliminating ghost gun loopholes and federal requirements for firearm storage. It urges Congress to earmark funds for gun violence research and violence prevention efforts. More recently, the AMA has thrown its strong support behind the Protecting Our Kids Act, which passed the House of Congress. This bill may not accomplish everything on our wish list, but it's an important first step in protecting children and families from the devastation of gun violence. We're all hopeful that deliberations currently underway in the Senate of the United States can achieve bipartisan concurrence. Folks, there isn't a corner of this country that is immune to gun violence. It touches every community, small towns to big cities, from the coast to the heartland. Ignoring this problem will only lead to more bloodshed, senseless deaths, grieving families. I know there are millions of gun owners out there, responsible gun owners in America. I myself am a lifetime hunter. I appreciate the importance of protecting the rights granted to us by the Constitution. But this isn't what we're talking about. We're talking about keeping weapons of war away from those seeking to cause mayhem and violence in our system. We can counsel our patients. As physicians, there's a lot we can do. We can counsel our patients on firearm safety, on appropriate gun storage, ways to keep them out of the hands of children. We can be active in the civil dialogue around gun violence prevention. We should be the leaders in this issue, and we are. Through the work here at the AMA and in our home states and our communities, we must do something. The time for Congress and us to act is now. I thank you. I ask that you all join me in a moment of silence for the victims of gun violence and the families they leave behind. Mr. Speaker. Thank you, and bless all of you.